So this next video is for those that need to work a little bit on their hip mobility when it comes to riding the bike. Our hip mobility certainly affects our dynamics, our biometrics in terms of measurements over the top of the pedal stroke in particular. If we are particularly tight into both flexion and internal rotation, then often the knee will be one of the drivers as to why the knee kicks out possibly at the top of the pedal stroke, because it takes almost the path of least resistance. So I'm going to show you 3 little mobility drills to do that you can try to work on, just to try and help to mobilize the hip joints a little bit into those positions. So the first one is simply to get yourself in a 4-point kneeling position, and it's really just to do some rock backs, which is going to close off the hip joint. I don't really want you to hold the position for any particular length of time, but almost just think about mobilizing it and going into a degree of stiffness. So the first one is really to try and get your back flat, and you're going to really just try and roll your hips back down towards your heels so your hip gets closed off a little bit through here. So if you imagine if you're riding a time trial bike or a less so a road bike, but you need to have that good mobility through the top of the pedal stroke. What you don't want to do when you roll back here, as it might be a little bit of a cheat, is for you to round your spine both in the lumbar and thoracic area. What we want to do is try and almost keep your back flat. If you can see yourself in a mirror doing this, if it helps, you can do that. But simply to roll on and off the back of the hips down towards your heels. What you can do to progress that and target one hip over another, and also add a stretch into the adductor on the inside of the thigh, is simply to put one foot out to the side and then roll back again. So you're going to target a little bit more specifically in the front of the tight hip, and also you're going to get a bit of a stretch through the adductor on the opposing side. And again, you might just roll on and off that position for sort of nice and easily for 20 and 30 seconds. Don't force it, you're just kind of going into a little bit of resistance and then coming off nice and gently again. To progress that a little bit further again, what you would do is actually take your foot up and outside of the hand on the same side, and you can simply just roll backwards and forwards, either getting a little bit of a hamstring stretch and opening up the hip flexor on one side, and either roll forwards and backwards when you do that. So you will push back and then ease forwards and open up the hip flexor and push back, keeping your foot flat on the ground, and ease forwards again. To just increase a little bit of a rotational mobility on that side, what you can actually add in is, as you push forwards, to actually open up and add some rotation into the opposite side there. Nice and easily, where you'll reach up and behind, almost follow your hand round with your head till you feel a little bit of a stretch. So it's a nice one for opening up your hips and your back in a rotational way. So give it a try, or drop us a line at Physio House and we can help you work on those individually.